Now, for this tutorial, we're going to visualize the broad spectrum antibiotics. So the first tutorial, we had the general antibiotic that is going to be used for peculiar classes. Now is the broad spectrum antibiotics. The first one, broad spectrum antibiotics, we have there are particular penicillins that are broad spectrums, and we have the synthetic penicillins. Basically, the synthetic penicillins are the ones that are going to be broad spectrum. Synthetic penicillin, peculiarly ampicillin and amoxicillin, are examples of penicillins which are broad spectrum penicillins. It can be used in multiple array of microorganisms. So those are broad spectrum antibiotics. The second broad spectrum antibiotics, we have cephalosporins. Peculiar cephalosporins which are broad spectrum. We have the case of third generation and fourth generation cephalosporins, which are more of broad spectrum and they can kill a wide array of microorganisms. The third one, we have still under the beta-lactam family, because most of them are under the beta-lactam family. The third one, still under the beta-lactam family, we are going to have also the next one, which is the imipenems. The imipenems are also under the beta-lactam family, and they are also used in broad spectrum antibiotics. And the fourth one, we have also the imipenems, example the carbapenem or even imipenem itself. Is it clear? And we have also the sulbactam. Sulbactam is an example under the sulbactam can also be used here. Is it clear? So now, apart from the beta-lactam family, we have the other families, like the one we have fluoroquinolones. Fluoroquinolones can also be used as a broad spectrum antibiotic, by peculiarly the third generation and fourth generation fluoroquinolones. The first generation are much more specific to Salmonella type and those other microorganisms you have to know, but the fluoroquinolone third generation and fourth generation are the one which are much more broad spectrum. Third generation and fourth generation are much more broad spectrum. After fluoroquinolones, we have also other penicillins. So we have after fluoroquinolones, we have also a next medication which is very broad spectrum, but is very least expensive. Is it clear? And that medication is also called clindamycin. Is it clear? It's least expensive, but has a very high broad spectrum activity. Clindamycin. Is it clear? So those are different medications which have broad spectrum activity and can kill a wide array of a microorganism. Is it clear? So we have synthetic penicillins, ampicillin, amoxicillin. We have cephalosporin third and fourth generation, imipenems, sulbactam. We have fluoroquinolones and clindamycins. Is it clear? So those are the different broad spectrum antibiotics. You see, I've still forgotten another microorganism. The Haemophilus influenzae again still enter under the gram-negative anaerobes. Is it clear? Haemophilus influenzae is the eighth one, and it enters under the gram-negative anaerobes. You have Haemophilus influenzae still under the gram-negative anaerobes. Now, after visualizing the broad spectrum antibiotics that are going to kill microorganisms, we are now going to visualize a specific antibiotic that kills each of the microorganisms that we have set in our list according to the SchrDbb.